Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. In the last blog, I talked about Charlie Gard, the little baby who wasn't allowed to die at home. You can check out the last blog by clicking on the link below this video. In this week's blog, I want to share with you the 9 myths of being a critically ill patient in intensive care revealed, and that's part 1 today. Having your loved one critically ill in intensive care is usually a scary, frightening, overwhelming, and challenging event. It's also an event where most families of critically ill patients in intensive care have preconceived ideas about what it means to be critically ill in intensive care. Most of these preconceived ideas are myths and don't actually reflect reality. A great deal of the angst, the fear, and the frustration comes from not knowing what to expect, not knowing what to do, and not knowing what questions you need to ask. Therefore, after nearly 20 years intensive care nursing experience in 3 different countries, where I literally worked with thousands of critically ill patients and their families, and where I also worked as a nurse unit manager in intensive care for more than 5 years, I have found there are 9 myths that families of critically ill patients in intensive care commonly think of being true or think of being real, and it's time to shed some lights on those myths, and it's time for you to discover the truth about those myths and what it really means to be a critically ill patient in intensive care. So let's dive right into it. Myth number 1. Being a patient in intensive care means knocking at death's door. Whilst this is true in some instances and cannot be denied, the overwhelming and vast majority of patients in intensive care leave intensive care alive. For example, in the United States, around 3 to 4 million people get admitted to intensive care per year, and mortality rates, which is basically the number of people who have died, are around 8 to 10%. In 2010, approximately 125,000 admissions have been registered to come to ICU in Australia, and quote-unquote only 6.5%, or approximately 8,000 of those admissions have been lethal and have actually died. Those statistics are similar in other developed and first world countries. It's also noteworthy to say that most literature suggests the severity of the critical illness is a deciding factor if a critically ill patient can survive intensive care or not, and it's actually not their age. To illustrate this further, the very elderly, which means above 80 years of age, quote-unquote only represent about 5 to 10% of all intensive care admissions, and yet have a survival rate of more than 85%. Therefore, the younger patients are the higher chances of survival, depending, of course, on the nature of the critical illness. Statistics from the ANZICS 2010 report for the Centre for Outcome and Resource Evaluation Annual Report 2010 of the Australian and New Zealand Intensive Care Society has those numbers and statistics, and I have also included other references in the written version of this blog where it gives you evidence of the actual mortality in intensive care. Nevertheless, one of the biggest, if not the biggest frustration for families in intensive care that we hear about at intensivecare-hotline.com is that intensive care teams are negative. They paint the doom and gloom picture from the very start of a patient's journey in intensive care to dampen patients and their families' hope of a successful recovery. As you can see, the statistics don't support the intensive care team's negativity, and if anything, everybody should be hopeful of a successful recovery, because the statistics evidently suggests that the vast majority, or more than 90% of patients in intensive care, survive their stay. Therefore, a fair question to ask is, why are intensive care teams negative if the statistics and the research don't support it? Well, again, after nearly 20 years intensive care nursing experience in 3 different countries, where I literally worked with thousands of critically ill patients and their families, and where I also worked as a nurse unit manager in intensive care for more than 5 years, and now I also see it in my own counseling, consulting and advocacy practice here at intensivecare-hotline.com, the evidence is crystal clear that the only way for an intensive care team to manage expectations, to manage their expensive and in-demand intensive care beds, as well as managing their financial budget and other resources such as staff and equipment, is to be negative from the start. It's also a strategy to quote-unquote manage and intimidate families in intensive care right from the start. The fact of the matter is that if your loved one is critically ill in intensive care, and if you buy into the negativity of the intensive care team, you are doomed. The fact of the matter is that if you don't question, if you don't do your own research, and if you are intimidated by the perceived power and the perceived authority of the intensive care team, you belong to the 99% of families of critically ill patients in intensive care who make no informed decisions, have no peace of mind, no control, no power, and no influence. Therefore, you need to question, you need to do your own research, and you need to get one-on-one counseling, consulting, and advocacy here at intensivecare-hotline.com with me, so that you can very quickly make informed decisions, get peace of mind, control, power, and influence. Staying positive and fighting the negativity from the intensive care team will be one of your biggest challenges, especially if you don't question and if you are intimidated. The good news is that you have come to the right place here at intensivecare-hotline.com, and we give you all the tools and strategies to make informed decisions, get peace of mind, control, power, and influence quickly when your loved one is critically ill in intensive care. Let's now look at myth number 2. And myth number 2 is, being a patient in intensive care means that decision-making regarding the medical treatment is entirely out of my or my family's hands. Now, remember, the number one rule in intensive care, as well as in real life, is that everything is negotiable. If you don't believe that, you have a mindset problem. Again, here at intensivecare-hotline.com, you get all the tools and strategies to change your mindset and therefore change the results that you will get whilst your loved one is critically ill in intensive care. Whilst there are decisions that can only be made by the intensive care team, everything is negotiable. In order to get to the point where you can make informed decisions, get peace of mind, control, power, and influence quickly, You need to look for the right answers, and you only get to the right answers if you are asking the right questions. Our website intensivecarehotline.com in particular is aiming at giving you in-depth and behind-the-scenes insight that will help you to make informed decisions, get peace of mind, control, power and influence in a situation where you most likely feel you are out of your comfort zone in a big way. The truth of the matter is, you feel that other people are in control of the situation. In order to change that situation and in order to change the dynamics so that you can actually make informed decisions, get peace of mind, control, power and influence quickly, you need to continually educate yourself and quickly learn about what is happening behind the scenes in intensive care, namely the politics, the intrigue, the dynamics, the hierarchy, and the psychology at play in intensive care. Once you have a good grip and a good understanding of those forces and how those forces impact on your critically ill loved one's care and treatment, that's actually when the dynamics change in your favor. And that's when you can make informed decisions, have peace of mind, control, power, and influence. And how can you actually find out what's really happening in intensive care behind the scenes? Well, I actually have written an entire ebook about that. The 10 things you didn't know are happening behind the scenes in intensive care that hold you back from making informed decisions, having peace of mind, control, power, and influence. And you can get that ebook by clicking on the link below this video in the written version of this blog. Let's look at myth number 3. Being a patient in intensive care means suffering and pain all the way along during the intensive care stay. The reality is that most critically ill patients do only vaguely remember their time in intensive care if it has been for a number of days or sometimes even weeks or months. The fact of the matter is, most patients do not remember their time in intensive care. The reason for that is that they are often sedated for mechanical ventilation, which is also known as an induced coma or a medically induced coma. In order to get into an induced coma, critically ill patients require medication that gets them into the coma. In an induced coma, patients are generally speaking pain-free and comfortable. If patients do show any signs of discomfort, usually they get even more sedation, including pain medicine, to increase comfort and tolerance for the treatment. If a critically ill patient doesn't require sedation to be in an induced coma, the patient's pain control is usually at the forefront of the intensive care team's management plan in order to control the patient's pain well. Myth number 4. Being a critically ill patient in intensive care is all about technology and equipment, and the human caring factor is diminished. Whilst keeping critically ill patients alive in intensive care can be about technology and equipment, and sometimes it can be really all about technology and equipment, for example, ventilators for respiratory support, infusion pumps, monitors, bypass machines like ECMO, balloon pumps, to only name a few. And you may also be surprised how much most of the intensive care nurses really do care about your critically ill loved one and your family. While some intensive care staff, doctors and nurses, love the technology aspect of their work, they mostly enjoy the interaction with patients and their families, and they do get tremendous reward and satisfaction out of their professions. Seeing people getting better after or during a critical illness is a very rewarding journey, and in some instances, even if people are approaching their end of life, helping families to deal with the end-of-life process, ensuring patients' comfort, as well as making sure families are able to understand the process around end-of-life care, is viewed by many health professionals, including myself, as a privilege. There is, however, one aspect of caring in intensive care that I must highlight, and if you have come to our website to look for independent advice and to do your own research, you may feel like your critically ill loved one is not getting the best possible care. And if that is the case, you may start asking yourself if the culture in the intensive care unit your critically ill loved one is in is either a positive or a negative culture. Do you think, from the interactions you had with the intensive care team, that they have a quote-unquote can-do attitude? And do you think the intensive care team has a genuine interest in doing their best for you, for your family, and for your critically ill loved one? Do you and your family feel that the intensive care team is prepared to do whatever it takes to get your critically ill loved one on their way to their recovery? If you can genuinely say yes to those questions, great. It looks like you and your critically ill loved one are in the right place at the right time if you can look at those questions and say yes. If you feel, however, the intensive care unit where your critically ill loved one is getting treatment at has a negative culture and has a negative attitude, then you need to start asking the right questions quickly in order to get what you want, need, and deserve. You should not and never put up with a negative culture because it will be to the detriment of your critically ill loved one, and the likelihood of the intensive care team playing politics with your critically ill loved one's treatment is very high. If the intensive care unit has a negative culture, they are often not prepared to do whatever it takes to save your critically ill loved one's life. Again, it all comes down to managing this negative culture and negative or even bad behavior from your end. The good news is you are in the right place because we have all the tools, tips, tricks, strategies, and real-world case studies for you so you can make informed decisions, get peace of mind, control, power, and influence. So, this was the first part of the 9 myths of being a critically ill patient in intensive care revealed. Go and look out for part 2 of the 9 myths of being a critically ill patient in intensive care revealed, where I share the remaining myths with you next week. Or click on the link below this video, that'll get you to part 2. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to make informed decisions, get peace of mind, real power, and real control, and how you can influence decision-making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what is really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's blog, and I'll see you again next week in another update. Make sure you also check out our Your Questions Answered section, where I answer your questions, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on our Contacts tab. Also, check out our ebook section, where you get more ebooks, videos, and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype, over the phone, and via email by clicking on the email and phone counseling tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.